We're about patient-first driven quality experience.
We want to be the facility that is known to be the best place to come when you need to have surgery.
We really have more of a family environment here. There's that sense of a team.
Even though you're not the only patient here, we're going to try to make you feel like you're the only patient. You are our #1 priority.
Hi there. This is Fredericksburg Ambulatory Surgery Center. If you need surgery that doesn't require a hospital stay, there's a good chance you'll get it here. Over the next several minutes, we're going to give you an idea of what you can expect should you put yourself in the capable hands of this caring medical team.
We give the best outpatient surgery care in the country.
We're a part of Mary Washington Healthcare, and the mission of Mary Washington Healthcare is to provide the best services to everyone in the community. We focus on the patient's experience. We try to, throughout the facility, have people who understand what they're going through.
Every patient, every step of the way, every day. That means from the time they come to pre-register to the time that they come to check in, have their surgery, nothing is left to chance.
The technology we have is the best that we have seen. It enables the doctor to get a better picture of the inner cavity of whatever he's looking at, so he can make a better decision or distinction of what it is he's looking at to help him in his surgery.
The safety of our patients is something that will never be taken for granted. The quality of the work that we do here will never be taken for granted.
Your FASC experience will begin well before your surgery. Your surgeon will provide you with a packet like this, with a number of forms for you to fill out. And once you've done that, you make your first trip to the Fredericksburg Ambulatory Surgery Center. Typically about 1 to 2 weeks out, you come in to pre-register.
Hi, my name is Holly. How are you?
I am one of our patient registrars here at FASC. We want to make them comfortable. We want to put them at ease the moment they walk in the door. We don't want any anxiety from the moment they register. We will guide you through the process and what you are doing here. We'll go through all the paperwork with you to make it easier for your day of surgery. Make sure that all your health questions are answered in regards to privacy issues.
After you register, you'll meet with one of the nurses here at FASC. You'll find out about a number of things like what to wear or whether you can eat or drink anything on the day of your surgery.
And those nurses will be also talking to the patients about their history, making sure that we get any lab values and EKGs and other tests that we need, because we just want to ensure that we know all the needs that patient's going to have, and we want to make sure that there's no medical problems that may keep them from having a safe experience here.
You meet with our nurse, you go over all the information, and then you're out of here and you're relaxed, and you know when you get here on day of surgery, you have nothing to worry about.
On the day of your surgery, you'll need to remember a couple of things. First, you'll need to have someone bring you and take you home, as you may not be in any condition to drive yourself. And also, be sure to arrive about an hour to an hour and a half early. And when you do, just walk right up to the reception desk and sign in. Hi.
You're going to meet one of our lovely receptionists. She's going to get your insurance card and your driver's license. She's going to ask, when was the last time you had anything to eat or drink? And who's with you as your ride home. She's going to cover all those bases. And she's going to put a name bracelet on you, and that's going to start the process that you're our patient. And then usually you'll have a seat out in the waiting room for a little bit. Mr. Collins, hopefully very promptly. One of the nurses from holding, they're going to come out and get you and bring you back to the holding room. And in there, you're going to start an interview process with the nurse.
Last time you had anything to eat or drink?
It was yesterday.
She's got a whole list of questions she's going to ask you.
It was like breakfast.
Okay.
After the interview process, the nurse is going to have you put a gown on. And we're going to protect you. We're going to protect your modesty. That's very important to us.
Once dressed in your gown, you can lay down and get comfortable. It's at this point where you'll have your vital signs taken, and then you'll meet your OR team, starting with your anesthesiologist.
Dr. Brown from anesthesia.
We'll assess the patient, their medical history, physical status, examine them. After that time, if an IV hasn't been placed, we will place the patient's IV. Typically, we will give you a sedative to help make you comfortable and relaxed if need be. Once that's administered and your surgeon has already talked to you, we'll take you back to the operating room, and that's where we will proceed with the induction of anesthesia.
My name's Ellen. I'm going to be the CRNA in your room.
You're going to meet the OR nurse, and then they're going to take you on back to surgery. They usually cover you with a nice warm blanket to make sure you're comfortable, and they'll take you on back to surgery.
We know that they're coming in to have surgery. We try to calm their nerves about that. Let them know that, yes, you're having surgery, but we're here to take care of you. You're in good hands with FASC.
While you're in surgery, the staff here will be taking good care of your family too.
Collins family?
Every person here has a role in making that person comfortable and their family members, because we know that if the person who comes with you when you come for surgery, if they're anxious, that makes the patient anxious, and that makes the experience less than what it should be.
So you're doing okay?
Yeah, thank you.
Hospital settings are very cold. We offer warm blankets. Is it anything else we can get for you? We want them all to feel comfortable here.
Okay.
When they come out of the OR, we update them at least 30 minutes to let them know that they're doing fine. If it's longer than that, we keep updating them.
We want you to have as little to worry about as possible.
Thank you very much.
You're welcome.
Hello. Hey, this is Mr. Carl.
After surgery, depending on what type of anesthesia you have, depends on which area of our recovery that you come out to. If you have general anesthesia, which means that you were put to sleep, you're going to come out to the stage 1 PACU. How are you feeling?
I feel okay.
Once they wake up, we see if they're having any pain, if they're having any pain issues, and the nurse helps them with that.
How about a little something to drink? I'm sure you're thirsty.
I am very thirsty.
In that room, most patients spend about an hour, but it just depends. Whatever you need. We're going to be watching your surgical site to make sure that everything's going well, and we're going to make sure that you're comfortable.
Once you're comfortable and recovered from anesthesia, you'll be put in one of these recliners on wheels. Your nurse will then take you to stage 2 recovery. In stage 2, you can have a snack and then meet up with your family or your ride home, and then get some last-minute instructions before discharge.
The whole time we're just going to be focusing on keeping you safe, keeping you comfortable, making sure all your questions are answered, and treating you like you're one of our family.
The facility has a very high patient satisfaction rating. In fact, we have been in the 99th percentile among surgery centers across the country for the last 3 years. That's a great accomplishment because there are about 5,000 surgery centers in the country.
Thank you so much. Once you're home, your FASC experience is not over. On the day after your surgery, you can expect a phone call to see how you're doing. And there it is. Hello.
I'm calling for Michael Collins.
Hi, thanks for calling.
We try to reach them just to touch base to see how they're doing, to see if there's anything that they need help with.
And you're taking your pain medicine?
We always ask, how was the care here at the surgery center? And it's just very rewarding when they say, oh, it was great, it was marvelous, it was wonderful, and it's such a good feeling to know that we've helped them through a very difficult process.
We hope this gives you a better sense of what you can expect should you need surgery here. Rest assured, if you need this team, it'll be here for you.
The Fredericksburg Ambulatory Surgery Center was rated like hotels. They would be getting 5-star service at every step of the way in their surgical journey.
It's the total environment, the staff, the technology, the things that have been put in place to be sure the patient coming in is going to get the best care from the front door to the back door.
The philosophy that the physicians and the nurses have at our facility is that the patient comes first.
We're going to guide you through it. We're going to take you through it. We're not going to leave your side. We're making sure you get in and out happy.
At the end of the day, I go home and I feel very happy that I know that we've given good quality care.